Story 1. Veterinary medicine. People continually express their frustrations towards us regarding issues beyond our control. The abuse from clients is so severe that suicide has become a significant concern in veterinary medicine. We all know at least one colleague who has taken their own life. Story 2. Cooking involves chefs who often struggle with unresolved anger issues and substance abuse problems. Even when something happens that is completely out of your control, you may get yelled at. I have been scolded for incidents that occurred on my day off because the chef found out about them while standing by my station. I once dealt with someone who was not my boss speaking down to me when I was just starting out because of a mistake I made. I have also been called a variety of slurs, many of which were homophobic. Essentially, those individuals need therapy. There are many stories about industry professionals in management roles who exhibit creepy behavior, such as sexual harassment, domestic abuse, and chronic infidelity. What I have learned is to avoid staying in an abusive environment, to replace anger with pity for these individuals who refuse to seek help, and to generally keep my distance from my coworkers' personal lives. Additionally, I've learned never to engage romantically with the servers, as it often leads to unnecessary drama. Story 3. Architect here. We frequently receive criticism from owners and contractors. We must endure it, as the industry relies heavily on relationships for securing future work. Story 4. Referee and umpire. To be fair, they're often deaf, blind, or suffering from a degenerative brain condition, so the extra stimulation from being yelled at can actually be helpful. Story 5. Being a doctor involves much more than just enduring criticism. It can be frustrating to be yelled at by individuals who may not understand the complexities of the medical field, a field in which you are a specialist. It is also common for people to berate doctors, claiming they do not know what they are doing, while simultaneously refusing to seek their own treatment. Story 6. Since a few people already mentioned customer service, I will add that working in nursing is challenging. Not only do you face verbal abuse from patients, their family members, your superiors, and other nurses, but you can also experience physical abuse. This occurs in addition to exhausting shifts and pressure from management. Overall, it can be a very difficult field to work in. Story 7. IT support. I have been yelled at for almost 30 years because of users and their interactions with computers. Story 8. Social worker. You will hear negative things about yourself, the organization you work for, and your background at least a few times a week. Story 9. Social workers. Special education teachers, police officers, correctional officers, mental health case workers, electronic benefits transfer center workers, customer service representatives, nurses. Story 10. Insurance underwriters face pressure from various departments. The finance and management teams urge you to maintain profitability and business performance. Sales demands your attention to write cases that meet quotas. Administration expects you to take care of tasks they prefer to avoid. Brokers and groups express dissatisfaction with rates, renewal actions, and other decisions affecting their plans. Even at home, your spouse may feel frustrated when you come home needing time to relax, but instead ask you to complete household chores. Story 11. Telemarketer. I did this for 2 years as a night job. If you can handle the hang-ups and insults, it wasn't difficult. However, you are interrupting people's lives to sell them things they didn't ask for. Amazingly, a lot of people will still buy it, especially if it has the name Disney on it. Story 12. I faced a lot of criticism while working in security at a casino. I wouldn't recommend it if you don't have thick skin. Story 13. Admin executive assistant. Getting yelled at for issues you not only knew about but warned everyone else about, or for things you had no way of knowing or fixing. Story 14. People want their mail and packages even from poor management. This applies to anyone in the business of delivering items. Story 15. Any kind of call center can expose you to unexpected situations, including sexual harassment. People can be very bold over the phone when they know they will never meet you. In some places you can hang up, but in others you may not have that option, which can make the experience even more challenging. People have said some strange things during calls. Story 16. Emergency room nurse. I now work with unpredictable individuals, and they are much less abusive than many normal emergency room patients. Story 17. Many valid answers have already been provided, but I must say I have never experienced more people yelling at me than when I was a cast member at Disney, especially when they had to wait longer than the posted wait time or when an attraction broke down. I have never encountered such rude behavior in my entire life. I have worked for several companies in retail, food service, hotels, and theme park guests are the most challenging. Story 18. Human services can be a thankless task. The people being served can often be rude, demanding, and difficult, yet they are sometimes justified in their behavior. As the saying goes, the customer is always right. I have been in the industry for over a decade, and unfortunately, it seems to be getting worse. While some people express their gratitude, these instances are few and far between. Story 19. Hotel manager. Rooms are not ready, rooms are oversold, rooms have bed bugs or other people in them. It's a long list of issues. Story 20. Telemarketing. I did this for 2 years as a night job. If you can handle the hang-ups and insults, it isn't difficult. However, you are interrupting people's lives to sell them things they didn't ask for. Amazingly, a lot of people will still buy it, especially if it has the name Disney on it. Story 21. My company sends out W-9 requests to doctors asking for their tax identification numbers as we work with insurance providers. We are not a scam, but we may give that impression. I receive complaints almost every day. Story 22. Mental health therapist. You have individuals demanding medications, connections to food and shelter. These individuals do not have their basic needs met and are constantly in crisis. On the other side are those who are extremely privileged and know only how to have their needs satisfied. A small inconvenience can send them into a spiral. I have worked with both groups. It is quite something. Story 23. Dental offices often face challenges as many people dislike visiting the dentist and dealing with insurance issues. Additionally, dentists may experience hearing loss over time due to prolonged exposure to drills without ear protection. Story 24. Many chefs experience unresolved anger issues and substance abuse problems. Even if something happens that is completely out of your control, you are likely to get yelled at. I have been reprimanded for an incident that occurred on my day off because the chef discovered it while standing by my station. I once had a colleague who was not my superior speak to me in a condescending manner when I was just starting out because I made a mistake. I have also been subjected to a variety of offensive remarks, many of which were homophobic. Basically, these individuals need professional help. There are many stories about people in management positions within the industry who engage in inappropriate behavior, such as sexual harassment and domestic abuse. What I have learned is to avoid staying in an abusive environment and to replace anger with empathy for those who refuse to seek help. I also try to keep my distance from my coworkers' personal lives and avoid getting involved with the servers, as it often leads to unnecessary drama. Story 25. My job is a prisoner custody officer. Dealing with prisoners during the court process means interacting with individuals who are stressed, confused, withdrawing from various substances, or experiencing severe mental health issues. Some may simply not be pleasant to deal with. Many exhibit a sense of entitlement or behave as if they are in a hotel. Story 26. Service advisor at a car repair shop. I tried it briefly before switching to working in the shop. It wasn't enjoyable. Story 27. In Britain, anything that involves dealing with the public is often met with unkindness towards receptionists or customer service representatives. Story 28. Retail pharmacy can be frustrating. I cannot express how often I am yelled at for issues outside of my control. Note: I am a licensed pharmacist in Maryland, so take this with caution. I do not set insurance copays or medication costs. The prescriptions your doctor sent are not ready at 9:02 a.m. We open at 9 a.m. I do not control drug availability, such as back orders or recalled medications. I do not know why the manufacturer is no longer producing your diltiazem extended-release 180 mg capsules. I do not know why your provider sent your medications to another pharmacy. I cannot stock every medication for every patient at all times. Sometimes, We must order medications for the next day. Most generic medications are not made in the United States. I do not control pharmacy hours. I cannot process your entire grocery cart while assisting other patients. I do not know why your insurance requires prior authorization or how long it will take. That is between your provider and your insurance company. I do not control the manufacturing process of medications, so I cannot explain why your pills are dyed, why your medicine is injection only, or why your tablets are a specific size. I cannot exchange pills simply because they do not work. I cannot administer vaccinations through the drive-thru. I cannot reserve medications or give limited supply medications to someone who arrives after others with prescriptions in our queue. I cannot fill 22 prescriptions 5 minutes before we close. True story. I cannot fill a prescription that is expired or out of refills. I do not know why your doctor did not prescribe you oxycodone. Adderall does not have refills. I do not know why your insurance lapsed. I do not know why your provider canceled your prescription. We receive only the order to deactivate it. I cannot fill a prescription from Mexico for a controlled substance that is not available in the United States. I do not know if you can purchase your medication over the counter in Ireland or how much it would cost, and I doubt your insurance will work there. I cannot provide you with a few methadone pills. I cannot replace defective medical equipment without you first contacting the manufacturer and opening a claim, e.g., diabetic sensors. I cannot mix all of your prescriptions and dispense them in a single vial. In summary, retail pharmacy can be challenging. Strength to my colleagues who are working hard in this field. Story 29. In New Zealand, I would say house mover, but back in the day, the next generation is a bit softer, so management has toned it down a lot. Story 30. Technical support faces challenges related to design or quality control issues and individual errors, neither of which are within our control. Our role is to assist with these problems to the best of our ability. Customers often express frustration at us, even when they are responsible for the issues. Developers and manufacturers may also express dissatisfaction when we bring problems to their attention. We are typically the last department to receive additional hires and the first to face layoffs during difficult times. Many of our roles require more education and experience than those in sales, yet sales staff often receive raises and commissions more frequently. While our base pay may be higher after commissions, sales personnel often earn significantly more. Story 31. I worked at different Whole Foods for 11 years, and we often faced angry customers. Sometimes I would start laughing, which made the situation worse. It was ridiculous how people would yell because we didn't have enough bottled water options or something similarly trivial. However, the frustrated customers who were upset with a product, rather than the staff, were my favorites to assist. I made sure they left feeling heard, often with a complimentary item or a refund. Those who complained politely received even more from me. I would have worked in retail forever if it hadn't taken such a toll on my body after years of repetitive tasks. Story 32. Sports referees can often face criticism. Nowadays, any job that involves interaction with people can lead to being shouted at. For those Americans who voted for candidates based on their loudness or outrageous statements, regardless of their truth, you are not just part of the problem, you are the majority of it. Story 33. Any kind of claims can arise in general liability. You would be surprised at how many people sign a waiver for their 3-year-old child at a trampoline park and then complain to the adjuster after the child gets double bounced. Story 34. Any job that deals with the public can be challenging. After many years in retail, I understand when issues arise due to a worker or due to technology. Items can run out of stock, work computers can experience problems, and yelling at a worker will not resolve your issue. If everyone spent a year working in retail, I believe it would lead to a better world. Story 35. Healthcare can be challenging. I have been working in healthcare for over 10 years now, holding various positions including pharmacy technician, billing specialist, PBX operator, and currently medical receptionist. If you work in healthcare, you need to be prepared for difficult interactions, as there are often times when individuals may raise their voices about issues beyond your control, and at times, even make threats. I am experiencing burnout and it is happening quickly. Story 36. I work for a nonprofit organization that provides care and living services to adults with intellectual and developmental disabilities. Let me tell you, they do not like being told no. Story 37. Customer service is often blamed. If a vendor doesn't ship on time, it's the customer service team's fault. If there is a production delay, it's customer service to blame. A shipping delay leads to customer service being held accountable. If it has rained for 4 days straight, customer service is still at fault. If the boss is in a bad mood, customer service takes the blame. If a customer is grumpy, it's customer service that is blamed again. Story 38. Telephone survey research involves calling individuals on behalf of the Centers for Disease Control and Prevention and various state health departments to persuade them to complete a 25-minute survey about their health practices, smoking, drug use, and sexual behavior. We sometimes have to dial the same number up to 10 times to gain the respondents' participation. Can you imagine how frustrated people are after receiving multiple calls? It is astonishing what some individuals say to me. Story 39. Military service is unique in its demands. Why do I say that? Because if a situation arises in any other job, you have options. You can walk away and never return or voice your concerns. Sometimes nothing happens, or you may even get fired. In the military, however, if you walk away, you could face serious consequences, including jail time. If you vocalize your frustrations, those in charge may take action against you. So yes, military service is different by a long shot. Story 40. Yes, the service and food industry is a very challenging career for low pay. I once dated a woman who was a server for many years. Unbelievably, she was rude and hard on servers when we went out to eat. I would say to her, "You did this job. How can you treat these people this way? Did you like it when people treated you the way you are treating them?" It was a puzzler to me and one of the many reasons the relationship didn't last long. Story 41. In my part of the world, I assure you, anything that does not require professional certification has an Indian supervisor. Story 42. Front-facing government jobs. The customers are literally everyone, and many disagree with the answers, laws, and other related aspects. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.